Hello everyone, my name is AZLINA and the topic that I will present today is kidney. So my content firstly is what is kidney, anatomy of kidney, and main part of kidney, function of kidney, clinical relevance about kidney, and expert Malaysian nephrologists. So now let's look at the definition of kidney first. Kidney are reddish brown in color. They lie behind the peritoneum on the posterior abdominal wall on the other side of the vertebral column. They are largely under cover of the costal margin. So basically the right kidney lies slightly lower than the left due to the large size of the right lobe of the liver. The upper border of the right kidney is at the level of 11 th intercostal space, while the left kidney is at the level of 11 th rib. Okay, now let's look at the anatomy of the kidney. From the external anatomy, the kidney has two main surfaces, which is the first one, the anterior surface, face the front abdominal wall, and the second one, the posterior surface, face the back. These surfaces are separated by the lateral converse edge, which the curve outward, and the medial concave edge, which the curve inward, where the renal hilum is located. So, since the kidney are located deep in the back retroperitoneal, ultrasound scanning is typically done from the patient back to get a clearer view. So, from the internal anatomy, the kidney is made up of two main parts, which is the renal parenchyma, which include the outer cortex, where filtration begins, and the inner medulla, which contain cone-shaped structure called renal pyramid. And the second one is the renal pyramid, which these are the main structure of the medulla, and they also contain the nephron, which the functional unit of the kidney that filter blood and produce urine. Okay, now let's look at main part of kidney. First we have renal capsule. The renal capsule consists of 3 layers of connective tissue or fat that cover your kidney. It protects your kidney from injury, increasing their stability and connect your kidney to surrounding tissue. The second one is renal artery. The renal artery is a large blood vessel that controls blood flow into your kidney. For most people at rest, the renal kidney pump a little over 5 cups or roughly about 1.2 liters of blood to your kidney each minute. Next is renal cortex, the outer layer of your kidney where the nephron, blood filtering unit, begin. The renal cortex also creates the hormone erythropoietin, EPO, which help make red blood cell in your bone marrow. The next one is renal medulla. So the renal medulla is the inner part of your kidney. It contains most of the nephron with the glomeruli and renal tubule. The renal tubule may carry urine to the renal pelvis. Next is renal papilla. This pyramid-shaped structure transfers urine to the ureter. Dehydration and certain medication, especially non-steroidal anti-inflammatory, are also known as NSAIDs, also may damage your renal papilla. Next is renal pelvis. This funnel-shaped structure collects urine and passes it down to ureter. Urine travels from the ureter to the bladder where it's stored. And the last one is renal vein. This vein is the main blood vessel that carries filter blood out of your kidney and back to your heart. Each of your kidney has a renal vein. Okay, now so let's look at the function of the kidney. The kidney are essential organ that perform multiple vital functions to maintain the body balance and overall health. Let's explore their key roles. First one, excretion of waste product. The kidney filter and remove waste product like urea and creatinine from the blood. These waste products formed during metabolism are excreted as urine. So the second one is regulation of water and electrolyte balance. The kidney maintains the right balance of water and electrolyte like sodium, potassium, and calcium in the body. This prevents dehydration or overhydration and ensures proper nerve, muscle, and heart function. And the third one is maintaining acid-base balance. The kidney regulates the pH of the blood by excreting hydrogen ion, the acid one, and reabsorbing bicarbonate, which is the base one. This balance is crucial for enzyme and cellular process to function correctly. Next, the kidney produces renin, an enzyme that helps regulate blood pressure. Renin activates a pathway to constrict blood vessel or retain sodium and water, increasing blood pressure when needed. And the last one is activation of vitamin D. So the kidney converts inactive vitamin D into its active form. Okay, so next I will talk about clinical relevance that related with kidney. The first one is chronic kidney disease, or also known as CKD. So CKD is a condition where the kidney gradually lose their ability to filter waste, excess fluid, and toxin from the blood. This process happens over months or years and is often irreversible. CKD is classified into 5 stages based on how well the kidney are working, measured by the glomerular filtration rate. Stage 1 indicates mild kidney damage, while Stage 5, which the end-stage renal disease, means the kidney have nearly or completely failed, require dialysis or transplant. In the early stage, CKD often has no symptom. As it progresses, common symptoms include fatigue and weakness, swelling in the leg, feet, or face, changing in urination such as foamy urine, increased frequency of blood in the urine, nausea, vomiting, and loss of appetite. CKD is diagnosed using blood tests to check GFR and creatinine level, and urine tests to detect protein or blood. Actually, there's no cure for CKD, but its progression can slow by controlling underlying conditions like diabetes and high blood pressure with medication such as ACE inhibitor or ARBs. The second one, from dietary change, a kidney-friendly diet includes low sodium to reduce blood pressure and swelling, and control protein intake to reduce kidney workload. And the last one is lifestyle changes, for example, quitting smoking, regular exercise, and avoiding alcohol. Without proper management, CKD can lead to heart disease, bone and mineral disorder, severe fluid overload, and end-stage renal disease requiring dialysis or transplant. Okay, now let's look at the other diseases, which is glomerulonephritis. So glomerulonephritis is a condition where the glomeruli, the tiny filtering unit in the kidney, become inflamed and damaged. The glomeruli are responsible for removing waste and excess fluid from the blood. When they are inflamed, the kidney can filter properly, leading to problems like protein or blood leaking into the urine. So there are two main types, which is acute glomerulonephritis, happens suddenly after infection like staph, throat, or viral illnesses. Symptoms may reverse with treatment. And the second one is chronic glomerulonephritis. So this is developed slowly over time and can lead to permanent kidney damage if untreated. So the cause of this disease, the first one, which is infection like hepatitis or HIV, and autoimmune disease where the immune system mistakenly attack the kidney. Okay, now let's look at the treatment. Treatment depends on the cause and severity. For example, the first one for infection, and the second one is for immune cause, steroid or immunosuppressant to reduce inflammation. Okay, now we are going to the last content, which is Malaysian expert nephrologist. Here we have Dr. Rosnawati Yahya. So Dr. Rosnawati Yahya is a renowned nephrologist in Malaysia with over 30 years of experience. Her specialty include kidney transplantation, glomerular disease, and healthcare quality. She holds leadership role in various organizations, including President of the Malaysia Society of Transplantation and Chairperson of the Malaysian Kidney Allocation System. Dr. Yahya has published numerous journals and completed her MBBS, MRCS, and FRCS from the UK.